afternoon, everyone. I'm Rita Walters. I'm the Vice President for Development and Alumni Relations at Union Theological Seminary. And it's my job to say welcome, welcome, welcome to Knowledge and Nourishment, hosted by our President, Dr. Serene Jones. Today, joining Dr. Serene Jones is, I'm here, just going to go to my notes here, is Reverend Brenda Ford. Do you want to just raise your hand here so we know? That's Brenda Ford. Serena is going to go into more of a description of each person, but I wanted to say hi. Also an Union alum, and also a Union alum, Kaytlin Butler. Raise your hand here for Kaytlin. So thank you guys. I want a couple of little housekeeping things. I'm going to stay in the background. You'll see me on the screen, but this is a conversation, and welcome to Knowledge and Nourishment. It's a webinar, Pastoral Care in the Time of COVID-19. There will be time for a question and answer session. We'll have about 15 minutes for that. So please use the Q&A function on your screen. You'll find that at the bottom. Start those questions as early as you want to. We'll try to get to as many as we possibly can. For those of you who may want to ask your question live and you want to be shown on the screen, please indicate that as well. And then we'll make sure that you are able to ask your question directly of the panelists as though you're sitting across from them or have joined the mic. If you prefer not to do that, I'm happy to ask the question for you. Just let me know which is your option. Okay, so without any further ado, I'm going to turn this over to Dr. Serene Jones to introduce our panelists and get started.
Okay, thank you, Rita, and thank all of you for joining in today for this very important conversation. I'd like to introduce both of our panelists who are very well known and held close to the heart of Union. We have the Reverend Brenda Ford, who graduated from Union in May of 2008 with an MDiv in Church and Society and Practical Theology. She's an ordained itinerant elder in the African Methodist Episcopal Church and has held several pastoral appointments as senior pastor. In addition, Brenda has received a call to serve in the field of chaplaincy. Her chaplaincy work includes over 10 years as an academic chaplain. She's worked in a correctional chaplaincy in Nassau County Correctional Facility. She's served on the Long Island Council of Churches as chaplain and food pantry director, and she works on call as hospital chaplain at the University Medical Center in Stony Brook and NYU Winthrop University Medical Center. She also currently serves as the chaplain and director of Protestant campus ministry at Stony Brook University. She provides spiritual care for students, staff, faculty, alumni, advisees, student clubs, including the Brothers and Sisters in Christ, the Korean Disciples of Christ, the Adventist Youth Ministry, and others. And she is also a lecturer at Stony Brook, where she teaches an undergraduate seminar in varieties of religion. Kaytlin Butler is also with us, who graduated from Union in 2017, and she is staff chaplain at Mount Sinai Hospital, where she works as part of the inpatient hematology oncology teams. She received her MDiv from Union and is also an alum of the University of Georgia. Kaytlin is certified, and when this was written, introduction was written, it says she was ready to receive a call in the Presbyterian Church USA. She has received that call and has been confirmed in it to continue her chaplaincy work with as a Presbyterian minister at Mount Sinai. So Kaytlin, congratulations on sharing that news with us today. Her work is to provide spiritual care. And many of you may have seen the article in the New Yorker, also in Time reports with Katie Couric, BBC World News, CNN, and Interfaith Youth Corps. So I'm going to jump into the conversation, and I want to start it off by just giving our audience a quick update on how Union is at this very difficult moment in time. We are charging forward, and our commitment to theological education has never been stronger. And indeed, our commitment to The formation of people prepared for chaplaincy has never been stronger. We have created this year, and it begins next year, a new specific track in chaplaincy, which focuses on interreligious chaplaincy and also chaplaincies with a social justice focus. As we look at COVID and as we struggle and wrestle and participate in the protests of Black Lives Matters, we maintain our focus on the mission of the school, which is to be the place where the cares of the world become the cares of theological education, to prepare people to do ministry there. We're excited that we have a large incoming class next year and that we have new dorms that are ready to take students and safely house them, preparing, if it happens, for a return of the pandemic. So that's where we are. The most interesting thing for today, though, is to hear about where these amazing union grads have gone. And so I want to start with a question. It's a very simple question, but gets right to the point. How has your approach to pastoral care changed during the pandemic and then changed during Black Lives Matter movement? How have your patients changed, and how has the work of your position been dramatically impacted by this? Maybe Brenda, will start with you.
Okay, great. Hi. A good portion of my work has changed primarily in that I'm no longer actually housed on campus, as my office is basically has moved to more of a virtual presence. In the beginning, when the students were removed from campus, most of the offices basically shut down, and we basically started working remotely. So I've been in contact mostly with students on campus, primarily via the phone, virtual Zooms. The course that I was teaching, we went from an in-person session to students having to Zoom in online and take the course. So a good portion of my work has been virtually, Zoom, cell phones, Microsoft Teams, as far as contact with patients at the hospital, mostly telephone and virtual work. So that has basically been the new norm for us here at Stony Brook, and the work that I've been doing here at the campus ministry with students.
And can I just add to that, how has the content of what you're doing virtually shifted? What is in the nature of that?
Well, for students, it has been, some students, it has been challenging. Those who have to return home, who may have not had PCs at home or adequate internet service at home, as far as reaching and trying to connect with students via the internet or Zoom. Most of the students are, I've been in contact with them prior that way. So it wasn't that bad, but as far as our courses or doing pastoral care, or most students sometimes want to have that in-person, touch and feel, sit down and have a cup of tea with the chaplain directly, as opposed to Zooming in, and there might be a dozen things going on in their household that they're not able to have those confident, quiet conversations that they want to have with someone one-on-one, as opposed to having the whole household listening in on what they're basically communicating and discussing.
Yeah. And how has it been, how has your work at the correctional facility been impacted?
Well, at the correctional facility, was that I believe towards the end of March, mid-March, all rehabilitation programs basically came to an end. The work that I was doing there was Mondays and Friday evenings, going in, doing support groups with the women that I basically saw, and then on 2-3 Sundays out of the week, out of the month, I would basically go in or bring a congregation in for worship services. All those services basically have come to a halt. So right now we're waiting to see when New York City lifts up, or the state rather lifts up the ability for us to be able to go back in to do that one-on-one with the inmates incarcerated, and then. But however, right now, I'm still in contact with them in some way through the correctional officers that I worked with the rehabilitation unit. And still keeping in contact and seeing what some of their needs are. We do get books and resources that we're able to leave behind for them, but as far as one-on-one, directly seeing them, that has not come to pass. And there has been incidences of COVID-19 actually in the county jail as well. So the safety matters there, and then the close proximity of living quarters as well.
And it also points to the absence in so many correctional facilities of any kind of capacity to virtually connect.
Yeah, and I know that from last I was there, I know they were working on getting some type of virtual camera system in place, but more so for the incarcerated to be able to be in connection with their lawyers, and not so much as far as with chaplaincy in the facility that I was in. Yeah, I know they're working on to maybe look at what might be happening later on, but right now that was not the case.
So the sense of, in both cases, you describe, well, in the first virtual, and the second very limited, but the sense of isolation.
Yes.
That
Yeah.
the chaplain
And
one.
I hear weekly or monthly, was it when the New York State, when Como started talking about opening up different things, I got calls immediately from some of the churches that I bring in on Sunday, wanting to know whether, are we on this week, Reverend, to go in and do worship services. And I'm like, no, we're still on hold right now. We're not in that upper tier yet to go in as of yet. So we're prayerful that, that time will come soon, but when, we don't know at this time. And then considering what they're seeing more cases of COVID-19 on the rise, it might be a while.
Yeah.
So
What an essentially
waiting.
So, and it's such an important support that has been lost for people already isolated. Kaytlin, as a hospital chaplain, how would you answer the question about how pastoral care has changed in the time of the pandemic and Black Lives Matters?
Yeah, so we've remained on site through the course of the last several months, and still, we haven't been able to go into rooms. We are now, but over the last, for some period of time, we haven't been able to, and have had to be very discerning about when we do and do not physically see a patient. It's required a great deal of care and forethought, and that is just, it has changed my work. It has changed my life. I think I can't underestimate, I can't speak enough to the importance of touch and of presence in pastoral care. And that is something that was taken from us very quickly. And we have all, I think, but hospital chaplains, all of us have had to figure out how to love each other in the absence of those typical expressions, how to show up, and how to ensure that those we love and that those we're trying to show care for know that we're showing up for them and feel seen. And so to that extent, we've had to be very creative and think on our feet a lot about how do you invent a ritual when you can't get past the door? How do you design a meaningful death when you can't hold the body, when you can't talk to the person, when your daughter can't be there, and it's just the bonds of those relationships at the end of life and the depths of those connections are, it's one of those things that you think you understand, and then when all of the physicality of it is stripped away, you just there's something about it that you just see it's all the more stark and heartbreaking. And yeah, it has been just it has been wild. It's been something beyond anything I think I could have ever, and I know beyond anything I know I could have ever imagined. And yeah, Yeah.
It's hard to imagine your work every day, both of your works every day. How have you figured out how to do a ritual or honor someone dying on the other side of the door?
Mhm.
And conveying, I read in one of your articles, your beautiful statement, how do I convey to them that they are loved
Mhm.
as they die?
You know,
How do you do that?
there's no one size fits all answer to it. I can't say that I've done, I've never done the same death twice. They're always unique. They're always profoundly sacred. Um, on, on several occasions, I'm thinking about the person that comes to mind most immediately is a woman who, she wasn't alert. I wasn't allowed to go in the room. It was very important to her daughter that the rosary be said, and that a blessing be offered outside of her door. And so I got a couple of the nurses and we held the phone, and she was able to offer that blessing in her own language. And we made sure that her mom had a rosary in her hand when she died. Um, Other thing, I can't speak enough to how incredible the people I work with are, and the ways in which they um, they're true healers, each and every one of them, true healers. And the personal links that they have gone to ensure that people get the best deaths we can possibly give them. So at one point I took to speaking with a family member on the phone, and asking them, what is it that you need your loved one to hear and to know in their final minutes, hours, days? And we would write it on a Post-it note and tape it to a Bible or to a Quran or to any item, and ask the nurses or whoever was taking care of this person while they were clustering care to just read that out loud to them over and over and over again. And it meant it meant something to them to know that those were the words they heard when they were leaving this world.
Oh, thank you for that work. And I'm sure it will take years for it to sink in what all has been learned from the work that both of you are doing, to sink into your own minds and hearts, but for all of us to be able to take in the magnitude of what's transpired. When you add to the pandemic the Black Lives Matter movement, how has that intersected or interacted with you are doing your work in chaplaincy and ministry? Maybe Brenda, you want to start?
I guess with the Black Lives Matter, it has been around for quite some time. I think with the pandemic has brought it a little bit more, the issues of racial disparities more close to home, and seeing that, the inequalities in healthcare opportunities for persons of color, African American, Black communities, whereas treatments or the healthcare issues or lack of health insurance basically put a lot of African Americans at risk. And I think, again, with the COVID-19, the pandemic basically has thrown it back out to all humanity that this is a public health issue, and that this health should be made available to all people, and at all levels, and not just for the some, and for those who don't have, they don't get. So for the Black community, African American community, COVID-19 has basically shown again to the world, the United States of America, that you don't do right by all people. And just because our skins may be a little darker in hue than anybody else, we're entitled to health care and appropriate health care and health treatments as everyone else is. So yes.
Mm-hmm. And do you see how do you see this playing out in the students that you work with at this moment?
Well, most of the students that I'm working with and so forth have either been out in the world protesting, and basically speaking again to the issues of Black Lives Matter, and hoping that that eventually somewhere along the line that people will start to listen, that God created all persons and we're all equal. We are all deserving of loving our neighbor as ourselves. So perhaps maybe we should start looking at some of the tenets that have been given to us in scripture as to really putting forth what has been expected of us to do in loving each other and treating each other as our neighbors, and looking that God created all humankind, and we all come in different races and hues and colors. So students, if anything, have been doing protesting, students have been having forums, and students have been having a lot of discussions, and looking to see what they can do to continue the movement, and educating or helping people to understand that, you know, we're here too, and we have rights as well.
Yeah, I remember during Occupy Wall Street, it was the first time I heard this term. And then at the beginning of Black Lives Matter, it emerged again. And I think it's so crucial, but it was a reference to the notion of being a protest chaplain, that people involved in the exhausting and exhilarating and non-stop heavy work of protesting need pastoral care as well. Can you say a little bit about that? Because you've been so close to it as a chaplain.
Yes, they do need pastoral care, and I have spoken to several students during this the recent deaths and ongoing deaths of Black bodies. Recently, I have not seen the newspaper on it, but I had a student reach out to me and ask me, did I read about some students, not students, but some Black bodies that were hung in California somewhere. So I haven't read up on that issue yet, but yeah, students are, concerned about their livelihood. Am I next? Who else in our, in our family, in our communities, what must we do? Or, what do I say to people who come to me and say, well, I want to help, but what can I do? Well, what do you think you should do? What are the, what systems are put in place that are continuing to keep African-American down and such? What are the things that, what are the, who's in leadership? What is leadership doing that is, constantly speaking, that against a unified body of loving everybody? So what systems or what work needs to be done that we can start turning the hands around this? Because this has been around, this has been around in the early 60s. I'm a product of the 1960s, but at the same time, this has been around for a long time. So how many times are we going to constantly keep going around and having these conversations, discussions? So students are organizing, grassroots groups are in formation to constantly keep this movement alive and having the conversations and discussions. And hopefully, maybe one of these years, or maybe soon, we'll see some changes coming about.
Yeah. Amen. Amen. It's been around 400 years.
100 years, yeah, several years.
400, yeah.
400 some years, right? We keep going around and so forth. So when do we, when do we say enough is enough,
Yeah.
and move forward?
Yeah.
When do we start, is as if those things that God is for, racism is against.
Yes.
So, yeah,
Absolutely. And all, even though people are scattered, union is on the streets full force right now. Mm-hmm. My hope and concern is that what is evolving now has longevity and isn't just a moment and then we revert back. But I want to turn to Kaytlin and ask you, in your work, have you seen the confluence of the effects of the pandemic and Black Lives Matter movement, and in your own thinking about race in the midst of this?
Absolutely. I've been really moved by the ways that a lot of medical professionals have been talking about protest as a public health intervention, and the importance of protest, and the ways in which systemic racism kills people and kills our patients. I actually spent some time with one of the nurses that I work with, who I was out because several of our oncology nurses have been very active in the protest, and I was asking her to share with me a little bit more about her experience, and she said she's just so incredible. She was like, the first wave, part of the reason the first systemic racism, healthcare disparities, is part of the reason the first surge was as bad as it was. So we showed up for our patients then, and we're going to show up for them here too. And that's the only way that we heal. That's the only way that we fix this. And then by way of my patients themselves, you know, Brenda talked about folks who are products of the 60s, and I have many patients who lived through the civil rights movement, who lived through the AIDS epidemic, and who the anger, the righteous anger, as well as the grief, is so profound. You know, I had a woman say it to me the other day, like, how many times do we have to tell them to stop killing us? You know, I've been saying it. She's like, Chaplain, I've been saying it my whole life. I'm tired of saying it. And it just it moved me. It was so convicting, so convicting, and also the fear for, you know, for my patients, those who are reaching the ends of their lives, the fear for what kind of world am I leaving for my children? What kind of world are my grandchildren going to grow up into, or my spouse, or, you know, my community? They're afraid of them getting sick. They're afraid they're going to get murdered. You know, there's just this, just profound fear for the future, and uncertainty that they're grappling with, on top of navigating complicated diagnoses and illness.
So for both of you, and Kaytlin, maybe you can start this question. In the midst of this hard work, what do you do to take care of yourself, spiritually and just physically, in this exhausting, but I know at times very empowering and moving labor that you're extending?
I tell my patients that sometimes just getting out of bed in the morning is a prayer itself. And that is the kind of grace I've tried to extend to myself in that vein. Particularly in the last several months, you know, I'm very fortunate that I have a group of coworkers that I love, and they love me. And I have so many friends and family members who have just shown up for me in ways that I will cry in front of 70 people if I really get into. And just the profound ways that I have been loved in the last few months have just given me so much strength, and that's what keeps me going. Many of whom I met at Union or through Union, frankly. Yeah.
Brenda, how are you doing self-care, taking care of yourself in the middle of having so many responsibilities in so many different places?
Basically, taking time just to be still. You know, Psalm 46:10 says, "Be still and know that I'm God." And at times, just basically just resting and staying still. Turning off the phone, turning off the cell phones, putting them on mute, turning off the TV, not even watching the TV, going outside, you know, yes, in the midst of, you know, COVID-19 with my mask and everything, and just sitting in the backyard and listening to the birds and looking at the flowers and just, you know, looking at nature. And yes, I also have a large network of friends, thank God, to Union Theological Seminary, in addition to the diverse places that I've worked at, and just was it a small group of friends, my accountability partners. We do buddy chats, and we check on each other and see how each others are doing, and making sure that, you know, we're taking that time away, because one of the things now that we've become virtually every day is like you're on Zoom. You know, it's like 8 hours, if not on Zoom, 8 hours on, was it Microsoft Teams, 8 hours, whatever your day is. at home, for those of us who are working from home remotely, you're connected to your laptop or your PC, and the energy that draws in from you from sometimes it basically makes you exhausted and tired. You may end up losing sleep from it. So making sure I craft out that time and maybe looking at my week and saying, okay, this is going to be an additional Sabbath day, and taking it and doing only things that will replenish, restore, revive, and renew myself. Those are things I've been trying to do.
Yeah, that's good. And you're both models for everyone. And my last question, and then we'll go to questions from others. And this is a short one, but I just love to hear your thoughts on it. In everything that each of you have said, I have heard the answer to this question, but I wonder if you could just say a word about the impact of your union education on what you're doing.
Union. Yes.
You can start, Brenda.
Union, if anything from Union has taught me a lot about social research, a lot about interreligious engagement, learning from other faith traditions, learning to be creative, learning to partner, learning to reach back and reach forward into touching into the current students and the older students, the alumni, and being supportive of each other, and realizing that we may be, yes, working in different sectors in life, but we are still part of a larger extended family. And that's one of the things that I truly remember about being part of Union, is that it's family, family from diversities of life, and you can always reach out to family, and you always to tap into the different source pools that are there to help you out in the journey that you're going through. So yes, and the work that I've done in church and society, looking at being an ethnography, more in the lens of pastoral care, and using those tools that I learned from church and society, from I think of my advisor at the time, learning how to really look into the families and doing more questions and being more curious and so forth will help you in the work that you're doing. So yeah, it's been a pleasure. So yeah, I'm thankful for Union.
Oh. We're thankful for your presence at Union and for what you're doing now. Kaytlin, the impact of Union?
Yeah, I remember a class with Dean Boyce, and I can't remember exactly how I said it, but there was a lot of spiritual distress that brought me to Union. I think that it can be true for a lot of students, of trying to figure out what your place is in the tradition. And I think Union gave that back to me. Union, both Union and my congregation gave me both a place in the tradition and a place in the church. And that's what I was searching for when I got there. And I think the most salient component of that for me is permission to not find redemption in suffering, and that was a really, really powerful learning that I came away from my time at Union with, which is true for me and maybe isn't true for everybody, but that's been a really important part of my own understanding of my vocation. And just to second what Brenda offered, the community, I say friends, I have people who I met there at such a formative period of my life that are my family, and will always be my family, and have walked a very complicated and convoluted path with me in my own path towards ministry. And I will be forever grateful for that.
And they'll all be celebrating you when you are appointed officially to your new job. So
congratulations.
Well, thank you both. There's so much more. I have so many more questions, and I want to hear so much more about the nuances of your answers. And I just want to say a deep thank you for what you're doing. It makes me proud to be the president of Union. and of the whole community to know about your work and to share it with others. And so now we're going to open it up to questions from those who've joined. And Rita, should I turn it over to you for that?
Yes, if you would, please. So thank you on behalf of all of us here at Union. Thank you for doing this and taking the time. It was so informative. We have questions that are already starting to come in. But before we get there, so in New York, we have a tradition during COVID-19 that was started. So at 7 o'clock each evening, we go out onto our balconies or raise our windows up, and really as an expression of our gratitude, we bang pots and say thank you. So I wanted to I have my pot that I use at 7, and to our first responders to say thank you, thank you, thank you. We are so grateful to what you do on behalf of so many others. And it's really rewarding to see how your union education has informed not just your work, but your very lives. So we have questions coming in, so I'll get right to those. So we have a question here from Mason, and Mason asks, any thoughts on how we can encourage our large institutions, so Stony Brook, Mount Sinai, to be introspective about racial inequality? How can we advocate for change for our pastoral role? Kaytlin, would you like to start?
Yeah, I mean, what comes to mind immediately is Mount Sinai has just created a task force on addressing racism that my colleague Rocky is contributing to, and I've been grateful for the ways in which the institution, as a whole, has taken on the task of dedicating time and resource to navigating how we can truly be an inclusive space. And how we can, and in so doing, take care of our patients.
Brenda?
I know at Stony Brook, we have a diversity office, diversity director who's working on a lot of different things in reference to racial diversity. In addition, at Stony Brook, there is a staff, it's a Black Faculty Staff Association, and they meet every Monday at noon, and it is an association of faculty, staff, persons from the hospital that get together to look at issues and concerns that are touching the African American Black community on campus, whether it's the hospital and the university, and they meet on a regular basis with the administration, with the president of the school, with different leaders and so forth, to make sure that if there's areas of concern that they think that needs to be addressed, they're on top of it. And these are the things that need to be done for the community at large.
Great, thank you. We now have a question from Ron Phillips, class of 69. So big shout out to the class of 69. Ron asks, to what extent are your patients affected by the polarized political environment, or yourself for that matter, and your efforts made that more difficult to offer some peace, some sort of peace, quiet nourishment? So I'll repeat the question again. To what extent are your patients affected by the polarized political environment, or yourself for that matter, and your efforts made that more difficult to offer some sort of peace, quiet nourishment? Brenda, would you like to start this time?
Patients, well, I'll go back to the staff, the students. I think, well, for myself, I was trying to offer peace and nourishment, just basically keeping myself spiritually grounded, keeping myself connected with my accountability group and with friends, spiritual director, the polarization of what's happening in the world. It's been around for a while, so yeah, it does wear on you. It does drain you, and ask you the questions of lamenting of how long, Lord. But at the same time, you just basically realize that eventually there will be something that will come from out of this. When, I don't know, but at the same time, still just making sure that singing a strange song in a strange land, and just knowing that eventually there'll be a time when all this will come to pass. When, I don't know, but in the meantime, not being content, but keeping abreast of what's going on, and whatever I'm able to do, or my circles are able to do, or my groups that I'm in are able to do, then we do them, and just hope for the best about the situation.
Kaytlin.
What's coming to mind for me is that I think sometimes offering peace and nourishment means being with rage, and means being with discontent. I think about my own. We're sort of at the in this intermediate space. It feels very eye of the storm-ish after this pandemic, and I'm not interested in feeling peaceful. I've told friends. I actually had a friend tell me, I just shared with my staff that I've been reading Edna St. Vincent Millay's A Dirge Without Music, like over and over and over and over again. And I had a colleague tell me, you're praying Edna St. Vincent Millay, and she's right. And the refrain in that poem is, and I am not resigned. I'm not resigned to bodies going into the ground. I'm not resigned to saying goodbye to them. And that energy I'm finding that energy feels very resonant with the patients that I'm caring for, and feels true in the hospital, and feels true in New York City.
We have another question here. This question is from Virginia, who's class of 1996. So big shout out to the class of 96. How do you handle staff comments that may be labeled racist or hostile, or comments that may contain insensitive language? Brenda, would you like to start?
I smile, and I keep those thoughts that are in my head, and I may at times let them know or educate them that what they just did or said was inappropriate. Since some people unfortunately are ignorant to what they do and say, and then some are not. So I decide for myself whether it's really worth whether it's worth having the conflict.
Kaytlin?
I think first and foremost, I should name that I am not excluded from unlearning, and I am still very much a student of anti-racism. And so when I encounter other people, particularly other white people who are also students of anti-racism, figuring out how we do better, how we learn, how we listen, I think that is a very live, that has been a live undertaking and continues to be.
Thank you. We are at 2 minutes before we have to end, which I hate to see us have to say goodbye. This has been such a rich conversation. Two quick housekeeping things. We're going to put inside the chat. Serene will have the final word, but before so, tomorrow evening, Serene is on another webinar that we invite all of you to who are attending today, entitled Art and Spirit in the Time of Social Justice. She will be in conversation with Anna DeVere Smith, who is an actor, activist, and writer. So again, you all are invited to join as our guests on that really important topic. So Serene, might you have the final word along with Brenda and Kaytlin?
Yes, just a word of thanks for your brilliance, for your verve and strength. And I deeply appreciate your straightforwardness. And I hope that among the many things that we teach at Union is to not be afraid when it comes to things like death and bodies going into the ground with no resolution or goodbye, or when it comes to 400 years of Black bodies being tortured and killed, and in the present moment, seeing it all over again. We talk straight about that because that's the task of ministry, is to put it out there. and to not walk away from it or sharp or smooth its edges, but to be present to it. And Kaytlin, what you said, that to never make suffering redemptive, which the flip side of that is to make liberation redemptive. And I see the two of you so deeply and personally and structurally as part of that liberation struggle. So I thank you for that, and may it come. So blessings to you both.
Thank you.
Thank you all for joining us today. Knowledge and Nourishment will continue throughout the summer and into the fall. We invite you back again and again for these really important topics of conversation. Thank you for joining us. Thank you to our alums, both Kaytlin and Brenda, and thank you to President Jones as well. Bye, everyone.
Bye-bye. Thank you.
Bye-bye.